From News 8, your local news source, this is breaking news.
Thursday, Friday, so 3 days. 3 days into it, I was able to stop by this morning and see the cars and the folks lined up participating. I want to express my gratitude for everyone that has said yes. If you've gotten that email, text, or call and gone in, thank you, thank you, thank you. Again, this is going to help us guide our way through the coming weeks and months ahead. Having this type of information, it really is informative, and it was just to see the Department of Health, to see the National Guard, to see Hoosiers from all over, all pitching in and doing their part, including, I talked to a mom who actually works at Riley Hospital, and she had her two sons, Declan and Brody, from Brownsburg, and so they drove in, and she was showing them how to participate and how to pitch in. So really a treat to see, and hopefully you'll touch on that as well as the numbers.
Yeah, it was very exciting for the team, Governor, for you to show up. Thank you so much for doing that. Good afternoon, Hoosiers. Today we reported 533 additional cases of COVID-19 across the state of Indiana, which brings our total to 36,578 Hoosiers known to have COVID-19. We also reported 27 additional confirmed deaths. To date, 2,078 Hoosiers have died of COVID-19, and another 180 are believed to have died from this disease based on their clinical diagnosis. We've also seen more than 291,000 Hoosiers get tested for COVID-19, which is up from nearly 249,000 just a week ago. That includes nearly 36,000 people who've been tested at our statewide sites through OptumServe. We have the capacity to test more, and I encourage you to register at this website that you see here to find a site near you and take advantage of this free resource. You can also access this information through our testing link at www.coronavirus.in.gov. We are also now able to test children under the age of 12 at these sites. We continue to maintain our ICU bed and ventilator capacity across the state, with nearly 37% of ICU beds available and 83% of ventilators currently available. Only about 14% of beds, ICU beds that are occupied by COVID patients, and about 5% of ventilators are being used by COVID patients. I have seen some reports about stages increasing in some areas of the state, about cases increasing in some areas of the state as we've moved from stage 3 and eventually we'll be moving to stage 4, particularly in Allen County. As we've noted before, that as we expect, when we open things up and people are getting out more, we will see more cases. And I think that's what's happening here. So we need to continue to practice social distancing, wear our masks, wash our hands, and stay at home when we're sick. Life is not back to normal like the normal we knew before COVID. Statewide, things are still moving in the right direction. I want to share the latest data from our partners at Regenstrief regarding statewide hospitalizations and recovery. Regenstrief has now looked at over 35,167 cases. Of those, 26% of individuals visited the emergency department, which is basically unchanged from last week. A total of 5,999 were hospitalized, which dropped slightly from a week ago and represents 17% of all of our cases. Of those who were hospitalized, 21% were admitted to the ICU. That represents 4% of our overall positive patients. 73% of patients have been discharged. Of the remainder, 9% are believed to be hospitalized, and just over 18% are known to have died, unfortunately, while hospitalized. Regenstrief also estimates that 67% of patients have recovered, which is an increase from 63% last week. This is certainly good news. I want to put in another plug, as the governor mentioned, for phase 2 of the IU Fairbanks School of Public Health research study, which runs through Sunday. If you've received a postcard, a text message, or an email saying you've been selected to participate, please get tested, even if you've already been tested. If you misplaced your access code, you can still get tested. Just call 866-254-3933. That's 866-254-3933, and give them your name so that we can verify that you're a participant and direct you to the nearest site. Finally, I want to share details about a special testing event that we're offering this weekend downtown. The Indiana State Department of Health, in partnership with the Marion County Public Health Department, will be offering free COVID testing in the parking lot at Ohio and Capitol near the State House tomorrow from 10 a.m. to 5 p.m. We may extend this testing clinic to Sunday if the turnout tomorrow warrants that. We recognize that protests by nature are acts of unity and that often it is difficult to socially distance under those circumstances at these events. We've seen thousands of people come downtown this week, some wearing masks and some not, which, as we know, will increase the risk for individuals to contact COVID-19. This is the 8th day of protests, and based on what we know about COVID infections, this is the time frame when we would expect to see some increasing level of infection because of that close contact. We want to help individuals who test positive so that we can share with them information they need to know for their own sake, for their health. But we also want to help them to be able to protect their family, their neighbors, their friends, and their community. Please consider getting tested if you'll be downtown this weekend on Saturday from 10 to 5. And if you're part of a protest in another part of the state, please visit our coronavirus website and register to get tested at one of our Optum sites around the state. We want to keep all Hoosiers safe and healthy and ensure that we keep COVID-19 under control so that as a state we can safely move to stage 4 and on to stage 5. Thank you.
Can I ask you a question that I'm anticipating that you're going to get? You mentioned if you've already been tested, please get tested again if you've been contacted. Do you want to share exactly why and elaborate on the importance of that at this moment?
Right. So just the fact that you may have been tested and test negative doesn't mean that you couldn't be positive now, right? There's no ongoing, we know that lasts for a week or 2 weeks or 3 weeks. The other things, if you tested positive, we'd love to know. In the past, if you tested positive, were your antibodies now positive? So that's the blood test that we're doing for antibodies.
Right. And we'll be doing this over a course of a year.
Yes, we have another
Yeah.
phase in the fall and then about a year from our first testing.
Perfect. Earlier on, as we were developing and then rolling out the Back on Track plan, I asked a group of diverse leaders and thinkers inside and outside of state government to come up with a rapid, as you came to, but a rapid recovery plan for Hoosiers who were experiencing a lot of instability or uncertainty in their lives due to the coronavirus, COVID-19, and the adverse impact it was having, the instability that it was bringing upon them and their families. As we transition and have plans in place, we wanted to make sure we were connecting with directly the individual, the people, and to think about how we can get back to that point to where you get to determine your destiny. You get to experience that upward mobility, whether you're transitioning to a completely different job or going back to a new job that maybe changed a little bit at your former employer. And ask them to bring me a plan that meets the needs of Hoosiers, those folks who, again, who are out of work or going back to work to a different job. And Teresa Lubbers, who wears multiple hats, she is the chair of the governor's workforce cabinet, but she's also, and previous to that, is the commissioner of higher education here in the state of Indiana. And you've put together quite the thorough and thoughtful plan and are able to share it with us today. Teresa?
Thank you, Governor. I appreciate the opportunity to do this. We know, as you've indicated, that more than ever, Hoosiers need education and training to actually provide a good job in a changing economy. The good news is that Indiana is uniquely positioned and prepared to address the economic issues that have been accelerated because of COVID-19. As you mentioned, the creation of the Governor's Workforce Cabinet in 2018 provided the framework for aligning and scaling workforce and education programs and funding. Through the state's Next Level Jobs, the Workforce Ready Grant has already connected about 25,000 Hoosiers to high-demand, tuition-free certificate programs, with nearly 12,000 Hoosiers completing a workforce certificate program, with a median annual wage gain of $6,400. We've also been successful with the employer training grant, with more than 530 employers served and nearly 9,000 employees trained. So this really is about people. We've seen successful results in both of these things, and while these are positive results, we now have thousands more Hoosiers who need access to affordable education and training. We are now going to be able to scale the Workforce Ready Grant and the Employer Training Grant to help even more Hoosiers, thanks to our announcement today that $50 million in federal funding through the CARES Act will be available. We're prepared to work alongside our partners in scaling these programs to ensure that Hoosiers are prepared to take the next step toward getting a new job or skill up for a better job with their current or a new employer. Our plan is people-focused, on the ground, focused on meeting the needs of Hoosiers when they need it most. Rapid Recovery for a Better Future meets people where they are, whether they're experiencing temporary or permanent job loss, or they're looking for ways to strengthen their career stability and their earning potential for the future. Rather than the government attempting to be the leading driver for connecting people to information, this initiative will utilize an active network of employers, community and faith-based organizations, and philanthropic groups, trusted sources of information for Hoosiers, so that they can learn more about the options within their own communities. Another way Hoosiers will learn about these resources is through a new online hub, which connects them to job resources, education and training, and financial options as well. Individuals can find one-on-one support and comprehensive resources at yournextstepin.org. Visitors to the site can talk to a real person to answer questions and help them determine the right path forward and the training options that will help them achieve their goals. These partners and tools help to connect Hoosiers to opportunities, some that already exist, and we will continue to build upon these connectors in the weeks and months ahead. Invested is an organization that has long been focused on providing students help in planning and paying for college, and it quickly expanded its mission to support the recovery efforts by helping affected Hoosiers access the next level jobs. Since launching their initiative only 3 weeks ago, they've engaged nearly 3,000 Hoosiers. Career coaches through Indiana Work One offices, the Skillful State Initiative, and the Governor's Coaching Corps, and Ivy Tech's Career Coaching and Employer Connection Initiative will also provide personalized assistance to Hoosiers to identify the best path forward. Indiana Career Connect and Work One offices around the state can help Hoosiers explore current job openings in their communities, and education and training providers are connecting Hoosiers to free or affordable state programs, such as the Next Level Jobs Workforce Ready Grant. All of this works to support the ultimate goal of helping Hoosiers take the next step, to get a new job quickly, to get a better job through affordable or free education and training, or access other critical support if they have immediate needs like food insecurity or struggles with mental health. Thanks to the $50 million in federal funding through the CARES Act, Indiana has the resources to scale up and build from what's working by expanding the number of tuition-free certificates available and the number of Hoosiers who are eligible for short-term education and training. Individualized career coaching and navigation for those who need help figuring out their next steps will be available. And this additional funding allows Indiana to strengthen our outreach efforts with special focus on the populations of people who have been most impacted by COVID-19, underrepresented populations, and those from rural Indiana. We know the National Strata Viewpoint Survey tells us that Black and Latino Americans are the most likely to have lost jobs due to COVID-19, with nearly a quarter of each of those populations having been laid off. Collectively, over half of Black and Latino Americans have lost jobs, hours, or income during this time. We also know that rural communities as well face lower educational attainment challenges along with higher unemployment rates. As I mentioned previously, engaging community, faith-based and philanthropic organizations as trusted sources of information to reach Hoosiers in need is a critical part of making this plan a success. For the past several weeks, leaders representing these groups from around the state have been meeting to discuss how their organizations can partner with the state to assist with the recovery efforts. To date, we've been in contact with more than 100 community, faith-based, and philanthropic organizations, a powerful, combined on-the-ground network to reach Hoosiers wherever they are. And Indiana is a leader in this plan in having a broad and influential group of organizations working together in response to the crisis. We know these organizations are trusted sources of information for individuals across our state, and that people are more likely to seek more education and training if they are encouraged by these groups to do so. A critical piece of this initiative is, of course, ensuring that employers have the resources they need to support employees' transitions back to the workforce after Indiana's recovery from COVID-19. The Indiana Chamber of Commerce has joined these rapid recovery efforts through its Institute for Workforce Excellence, and they're offering a collection of free, on-demand webinars to address workforce safety, along with a variety of government and financial assistance that is available to Hoosier businesses. A focus on mental health services in the workplace through the Wellness Council of Indiana, and an emphasis on the importance of internships and talent development during this time is critical through Indiana's Chamber's internet-free internet matching services. The state's Chamber's vast and diverse network of employers provides another key support to this initiative's outreach network. And of course, individual employers are partnering with education and training providers to help Hoosiers skill up quickly for new jobs in the time of need. In particular, I want to highlight two initiatives led by Ivy Tech Community College. First, Ivy Tech worked with its employers to create an employer resource page focused on helping businesses meet their talent and workforce needs to recover from COVID-19 quickly. Ivy Tech has also stepped up by setting a bold goal to reach at least 10,000 Hoosiers and help them earn new skills quickly through free courses and short-term training. In our efforts, we want to recognize the importance of life learning that can help Hoosiers transition to new opportunities. Learning gained outside the classroom can be evaluated and assessed and can jumpstart new employment or education opportunities. We will work with Hoosiers, educators, and employers to value those life experiences and the dignity of a life of work. So thank you, Governor, for this opportunity to share our rapid recovery plan. We want Hoosiers to know that we have their back so they can move forward. We've been intensely focused on this work through the Next Level Jobs program since the creation of the Governor's Workforce Cabinet, and in the weeks ahead, we will be rolling out even more ways we can strengthen Indiana's economic recovery by focusing on the people who make it work.
I love it how you say that. It's expanded and accelerated because of these times. And to learn more about these resources, again, go to yournextstepsin.org. This is critically important, and you know, that hierarchy that we had on the screen there for a second about where you are right now and where your future is ultimately. I think it's also, I mean, that just underscores the importance of right now and the rapid reaction and the rapid deployment of resources that are there for you, but it's also cyclical. So once you get to that top, you can go back and continue to go up again. That's what the whole upward mobility, it's perpetual. It's not ending. It's about maximizing your maximum potential, not some artificial minimum expectation. So critically important that this is out on the street right now. Thank you for putting that all together. And I hope folks will go to that website, yournextstepin.org. And next we'll have the director from the Office of Management and Budget, Chris Johnston, give us a revenue report.
Good afternoon, Hoosiers. My name is Chris Johnston, Director of the Office of Management and Budget. Earlier today, the State Budget Agency posted to its website the monthly report for May tax revenues. May tax collections were estimated to be just under $1.2 billion. Actual collections were a little over $954 million, a shortfall of $233 million, or almost 20% of the forecasted amount. While this month's shortfall on a percentage basis was just half of the shortfall of last month, please remember that April tax revenues reflected the tax deferral from April to July. Year to date, our revenue collections are $1.2 billion, or 8% behind our forecast. Our next slide highlights the breakdown of the May collections of the $954 million. Sales tax missed its revenue estimate by about $100 million. This is an amount similar to last month. This 15% difference of both amounts does align with the consumer spending drop-off that the Bureau of Economic Analysis just reported in the month of April. And as a point of reference, sales tax is generally a slow and steady revenue stream. Even in tough economic times, there's usually a growth pattern with the sales tax. But our May collections have not been at this level since 2013. Our next category, individual and corporate income taxes, were down $75 million. And as you can see, again, there were no wagering taxes as our casinos were closed. The next slide takes a look ahead to June. June is our highest forecasted month after April at $2 billion. So June will have similar challenges to the month of April, but perhaps not as severe, because April's estimated and actual tax payments included those payments that were usually due when you file your tax returns in April. So for the months ahead, the budget agency will be working with agencies. As we spoke before, there is a reversion or spending target reduction, and those spending plans are coming in, and the budget agency, along with those agencies, will be reviewing those spending plans. We will obviously be monitoring the payments that come in June, and obviously monitoring the payments that come in July, and to see what collections rate those occurred. And then finally, monitoring, as we always do, any potential for additional federal assistance coming out of Washington.
Thank you, Chris. And now Commissioner Fred Payne from the Department of Workforce Development. You've got some new and current unemployment numbers to share.
Good afternoon. We continue to see a decline in weekly initial claims filed in Indiana. For the week ending May 30th, we saw 23,591 initial claims filed. Since March, our unemployment insurance program has paid out approximately $2.3 billion. That number includes about $613 million in state funds and about $1.6 billion in federal funds. In May alone, we issued payments of almost $1.5 billion. We've seen over 2.1 million call interactions since April, and over 736,000 in May. Our call wait time continues to progress. This week, we saw a call wait time of an average of 24 minutes. That's about a 75% decrease over the last 4 weeks. Governor, we're excited about the rapid recovery initiatives that we shared here today. Thank you.
Thank you, Fred. And with that, we'll go right to the questions on people's minds.
Emma Kate, Chalk Beat.
Good afternoon.
Good afternoon, Governor. I have 2 questions for you today following the IDOE releasing reentry guidelines for schools this morning. First, how will the state enforce some of these guidelines for schools in the fall? Will they be monitored, or could a school open without making some of these health and safety considerations? And second, how will you ensure that schools have the funding to take some of these precautions?
Sure. You want to talk about the health guidance so to take a step back, the guidance that we've put forward, the recommendations that we put forward, FSSA and the Department of Health, you both might want to speak to this, have been working step by step with the Department of Education to make sure that schools can safely open come July, August, right around the corner. And the superintendent of public instruction, Dr. Jennifer McCormick, will be hosting a webinar, as I understand it. Dr. Box will be hosting some meetings with our local health departments throughout the state, all 92 counties, to be able to answer any type of question that arises about the health and safety environment. Those are the questions and the guidelines or the recommendations that you asked about, Emma, that are in place. But we believe where we are right now, schools can and should open for instruction. And we wouldn't have made that decision or endorsed the proposal to go forward if we thought otherwise. You want to add to that, but they are recommendations. They are guardrails that we put into place. And if it's someone who a school that chooses a hybrid approach, an e-learning and an in-school, both options, so be it. There is no one size or circumstance that fits all. We get that, local community by local community, but FSSA and the Department of Health and the Department of Education will all be in this together.
And I think the really important thing about the guidance that we put out is just that it's guidance. It's using the basic premises and the important things that we know that the CDC has said about opening up anything across the state and then applying those to our school systems. It really emphasizes the importance of the school's relationship with public health, whether that's their local public health, hopefully first in their own counties and communities, or whether that is the relationship with the Indiana State Department of Health. We will all stand ready to be there to support our schools for questions, concerns, or issues that they have. The important things that we are trying to emphasize is that as much as possible, when schools can cohort students and keep them together in the same room with the same kids, with the same teachers, when they can eat together rather than in a large cafeteria that has 200 or 300 kids in it, when schools, as they transport kids on the bus, can make sure that students sit in about the same place, so we know if somebody is exposed or becomes COVID positive, who would have been sitting around them that we need to be able to contact and to investigate further, making sure that rather than having all of the desks in a big circle, that we actually have them more facing straight forward, and that students, when they're in groups, like to go to the bathroom or to get their lunch or whatever, that they do have masks on. But maybe while they're sitting and getting their instruction and everyone's facing forward, so you're facing the back of somebody's head, you take your mask off and you're able to get your instruction that way. And that importance, that really, really important thing of not letting your children come to school. A big part of this is education, not only for parents, for staff, for teachers, but if you're sick, if somebody at home is sick, absolutely, if somebody at home has COVID-19, you don't come to school. That's very important because you may not be showing signs or symptoms, but you may very well carry that to school and infect other individuals. So there is a lot of guidance there and questions and concerns we know will arise, and Dr. Sullivan and I and Dr. Weaver, who is my Chief Medical Officer, will be available to have discussions. We hope to be able to spend time with the school nurses, superintendents, principals, as indicated in the next few weeks.
Dr. Sullivan, you look like you have some thoughts going on behind that mask. You want to chime in?
Good afternoon, Jen Sullivan, FSSA Secretary. Just a couple of additional comments. Thank you, Dr. Box, for allowing us to participate in this process, and Dr. McCormick as well with Department of Education. As you know, Indiana did not close child care settings throughout the pandemic, and the lessons learned for protecting children in the child care environment informed the health decisions that we helped Department of Education to build and endorse. We also have looked at countries and states that have gone ahead of us and looked at the data around children, around the spread of virus from children to adults, and believe that the risks and benefits of school opening certainly favor the benefits of kids going back to school, being fed in a school environment, their mental health, social, emotional and needs for the learning environment that will be promoted by going back to school safely. We're also very excited for this really new tight partnership that we have between public health, social services, and education, because they all really blend together to make sure that we have healthy, happy, and learning kids and families. So thanks for letting us be part of this project.
Thank you.
Angelica Wayne TV.
Good afternoon, Angelica.
Good afternoon. As you guys kind of talked about, a lot of these are just recommendations that should be implemented in schools. Are there any specific requirements, though, for school districts regarding reopening schools as it pertains to if there's cases of COVID-19 in students or staff, as opposed to just these guidelines?
So we have not specified this as a mandatory thing that a school has to do. We have given some very good recommendations and guidance and really feel that our superintendents, our principals, our teachers, in conjunction with their local health departments, are the individuals that really need to make this decision about their community and for their community. That does not mean that we're not available as a resource to our schools and to all of our school nurses across the state and want to be there as a resource. But there may be times when we feel the rest of the state is fine, but there may be a particular community that has an outbreak and the decision is made that the school needs to close for a period of time. But for the most part, if we continue to do those things that we know will decrease the spread of COVID-19, and we do contact tracing and know that we can contact trace every individual back and that we don't have a large amount of community spread, schools should be able to stay open safely and educate our students.
Part of our staged process, and so if we continue to make progress and stay moving forward, we can do this.
Lindsay Erdody, the Indianapolis Business Journal.
Afternoon, Lindsay.
Good afternoon, Governor. I have a couple questions. First, wanted to clarify real quick, the $50 million for those workforce programs, was that part of the $2.4 billion the state received from the CARES Act, or is that a separate fund?
It was indeed.
Okay.
Part of it, yeah.
Okay, thank you. And then I'm curious if you could talk about why you haven't met with the Black Legislative Caucus yet and what your thoughts are on some of their suggestions they released this morning, including banning the use of chokehold restraints.
We do have meetings scheduled with the Indiana Legislative Black Caucus. We're talking to multiple groups. I appreciate their input. We are gathering, we become a repository for lots of very constructive thoughts about how we move forward. So I appreciate, I was able to speak to them earlier this morning, just out in the State House, very briefly. We didn't get into a lot of detail or any detail regarding the press conference that they held today, but they're going to be a very important, make a very important contribution here in not just this discussion, but the progress that we make. I hope that everyone that wants to be constructive and move the needle in a very positive direction also feels the sense of urgency that we both share on this front. We need to listen, and most importantly, I think we need to act. So we're taking a lot of time to make sure that we hear from everyone that shares these concerns, and we're not exclusionary. And we're going to be very thoughtful about the actions that we do take. So I appreciate theirs.
Kathy with the Ferdinand News.
Afternoon, Kathy.
Good afternoon. Hope it's a good Friday for you. I have two questions that are not necessarily related. I think maybe the first for Dr. Box, or I don't know if Dr. Dan is there. And this all sort of becomes personal. A relative by marriage in a nursing home, her roommate was diagnosed with COVID, so they moved the roommate out and they're testing her. And my question is, how frequently are people tested in the nursing home? They'll test her, they said they'll know in 24 hours, but I bet a lot of people might be curious about this.
Sure.
How does that work in that situation? That's my first question.
Dr. Dan will answer your first one.
Take my mask off, sorry. Dan Rosiniak, Chief Medical Officer for FSSA. So in terms of how frequent residents in nursing homes are tested, it depends a little bit on the nursing home. So for instance, are they a facility that has had no cases of COVID in either the staff or the residents and nobody has symptoms? In that setting right now, testing would really be at the discretion of the local clinical providers. If they're a facility though where there is a resident student who has developed symptoms or a staff, then testing can become more widespread and certainly more frequent. So often somebody would develop symptoms, we would help go facilitate that test and then follow up by testing everyone in that facility. Once somebody has been tested, the decision whether to retest them can depend on a couple things. One is, do they have symptoms? If they don't have symptoms and they tested, for instance, negative, they may not need retesting. If they have symptoms and they test negative, then sometimes what facilities will do is either move them and just watch them and to make sure that their symptoms resolve, or often will move them and repeat testing. So kind of the short answer is the frequency of testing depends on the facility and depends on the residents in the facility and their symptoms.
Second question.
Thank you. Yes, my second question, it actually came from a small business who is very concerned, very much relies, has a business, but also relies on outside events that have all been canceled for funding, and said if this business has to pay their sales tax, it will kill their business. And they wondered if there's going to be any relief, or if they didn't pay them and hesitated whether they would lose their retail license and their ability to buy wholesale.
Chris Johnston is making his way back up.
Yes, at the current time, there is we are not considering a sales tax relief program. Obviously, for some of the slides that I just went through, sales tax is an important revenue stream, and we understand it's already having an adverse impact on not only the state but businesses that you refer to. But it's something that I think is being discussed out in Washington as far as potential future legislation that could be used in state and local governments for what they term as revenue replacement. But at this time, there isn't a plan within our resources.
Yeah, and Chris and Kathy, and back to Lindsay's point, I should be polite and thank our congressional delegation about that CARES Act that we've talked about a couple different times. This has allowed us to be very creative and target where this funding, how it gets to people. And so we'll continue to take this very same approach as you roll out different programs.
Abdul Hakim Shabazz, Indy Politics.
Afternoon, Abdul.
Good afternoon, Governor. A couple questions. On that school report that was out today, it says schools should follow the most restrictive CDC measures, but it also says the most restrictive measures are virtual schools. So which ones should schools do? That's question number one. And number two, by expanding your executive order to July 4th, does that mean that local governments can still meet virtually?
So with regards to schools, I'm not sure, Abdul, if I understood your question exactly, but the school, depending on the level of infection within the community, may decide to do more virtual, or depending on their teachers' risk factors, may allow teachers to do certain things virtually. We also have talked about different options where, even though junior high and high school students need to have different teachers, potentially a teacher could teach virtually from another room, but still have that same group of kids in the same room. So it can vary, and it really is up to schools to be as creative as they want to be. I mean, I've seen all kinds of different plans from across the United States where some systems are planning on bringing individual kids back in middle school certain days of the week, in high school certain days of the week, in elementary certain times. So it really is as inventive as the school systems want to be with those basic underlying CDC recommendations about how to prevent the spread of infection.
WDRB, Chris.
Chris, good afternoon.
Good afternoon. Can you hear me?
Loud and clear.
Okay. Sorry, long-time listener, first-time caller here. Indiana has been ahead of Kentucky in restaurants, retail, the timing of most every respective reopening. Yesterday, Kentucky Governor Andy Beshear said he would allow historical horse racing, which of course is very similar to slot machines, this coming Monday, while casinos in Indiana remain closed. I'm curious if you have any reaction to Kentucky allowing gaming to resume next week, any concerns about a competitive disadvantage for the industry in your state. And also, I understand casinos are in your stage 4 on June 14th, but do you have a specific opening date for casinos?
No, they're scheduled in stage 4, so they'd be at midnight June 13th. The next day, June 14th, we're in stage 4 where casinos would open. Horse racing is in stage 4, operates with no spectators, and then in stage 5 with spectators. To be honest with you, this is all about health in the state of Indiana, as it is in Kentucky as well. I love our southern neighbors. But when you say competitive advantage, we're looking at numbers, and we're looking at this in a staged manner and process. And so we think we're on the right course, but this is not about trying to make more money. This is about safety first, and that's why we always say in these 5 stages, we're seeking to take steps forward, not back. And that's why we're being very thoughtful about this. Do you want to add anything?
I just want to reiterate that even when these open, I think that the gaming, like the casinos, will be a decreased percentage of people there. And I think that's really critical so that there can be more social distancing and cleaning and masks and other things.
Yeah. We're not trying to jolt the system all at once. That's why we've spread this out to slow the spread.
Whitney Downard, CNHI.
Hello, Whitney.
Hello, Governor. I've got a clarification and a question today. Okay. My clarification is for Dr. Fox. Information posted by CMS indicates that no state in the Chicago region for nursing homes has cited any homes for infection control violations since March. Is that the case? Are you guys not investigating, excuse me, inspecting homes specifically for these violations? And then I have a second question.
Dr. Dan.
Sure.
He's already there.
I know. So since the pandemic started in March, we've been to, I think, over 2,400 nursing homes. And a lot of those visits were, in the sense of CMS, were similar to inspections where we went, made sure they had plans in place, made sure they had appropriate infection control practices as well. It's only been in the last several months that CMS has asked to start doing regular surveys, again, specifically for infection control, and we're actively doing those, and we'll be completed all of those in all of the nursing homes by the end of the state. But we have been in nursing homes, I think on average, every nursing home at least 4 times since this pandemic started, and continue to go out there every day.
Whitney, you said you had a question as well as the clarification.
Yeah, and I should specify that first question was more about if we'd had any violations. States in other regions have had violations.
Gotcha.
And then I have a second question, if that's not related.
I don't have the most up-to-date data, but we have done several immediate jeopardy investigations since this began, because if we are in a facility and we see something that we think may put the residents at risk, we will do those. I don't know off the top of my head right now how many we have. The last time I think I had that information, it was 3 or so, but we can get that information.
Your second question?
And then, yeah, sorry. So CMS is allowing states to use their own discretion when deciding whether or not to utilize enhanced penalties for nursing homes with repeated infection control deficiencies. A few states, including Indiana, have rarely penalized these sort of deficiencies in the past. Will you abide by that CMS directive? Are we planning on utilizing those enhanced penalties or not?
I think the short answer is we're going to follow the guidance that CMS has given us, and we're going to go into facilities, and if we find that there are practices that are putting residents at risk, we're going to cite them.
Rob with the Wabash Plain Dealer.
Rob, I wore it for you.
Appreciate that, Governor. I see it.
Not just for you.
Well, oh man. Some of the local government bodies I cover are reverting back to not broadcasting their meetings online and only holding meetings in person. Many others have continued, though. I know you've said Hoosiers 65 and older and those who are immunocompromised should still stay home despite the start of the staged reopening. What is your message to these governmental officials regarding offering remote access to public business during this time?
So as we go forward, and even when we go to stage 5 and establish our new normal, which means that things will be hopefully back to what we consider our new normal, it is going to be important for individuals that are at increased risk to continue to protect themselves. I understand the need for some meetings to occur in person, and I respect and want to respect every individual community's ability to make the decision there that is best. I hope that we will continue to make accommodations for individuals that want to remain engaged and individuals that want to continue to be able to do their job as much as possible from a remote standpoint if that is important for their health.
Yeah, and I would just say, Dr. Box, we report on this every time we meet, and I keep track of it on a daily basis. But just to underscore, Rob, you mentioned 65 or older. You mentioned the age, and also Dr. Box just talked about the underlying health conditions being important. We know we're still living with this. It's still spreading. We're learning of more cases throughout the state of Indiana, but it's important to note that 51+% of the deaths have occurred at the age group of 80 or above. About 76% of the deaths 70 years old or older, and then 92% of those are 60 or older. And so when you think about the whole spectrum of underlying health conditions plus age, there's a spectrum there, and you need to be very aware of that. 3% are 50 years old or younger, only 3%, and those have to do with underlying health conditions as well. So we just have to be aware of who and how this is affecting our population, every single one of us.
Hope with the State House file.
Good afternoon.
Good afternoon. I had a question for Governor Holcomb. What input regarding the document that the Indiana Department of Education released this morning? What input did the governor's office have in that plan for school reopening, and how closely did you work with Dr. McCormick on it?
My immediate office, the administration, worked for hours and days and weeks together answering every question, but not just my office. The Department of Health and FSSA were on call. Basically, the two physicians were on call to answer every single question in terms of all safety concerns as that plan was not just constructed, but before it was put out. You want to talk about just how much thoughtful effort went into this?
There were a lot of hours put into this, a lot of discussion. There were a couple of very long in-person meetings. We had input from Katie Jenner here, who represents the governor's office. We had input from the Department of Education's team, Dr. Sullivan, myself, Jane Jankowski with the governor's office, and we all worked together. There was a lot of pushing documents back and forth and tweaking things and making sure that things agreed. So I thought it was a great collaboration and partnership, and we will continue to collaborate as things potentially change as we go into the school year and have to adjust.
We're here to complement one another.
Eric Berman, WIBC.
Good afternoon, Eric.
Good afternoon, Governor. I had a second question as well, but I wanted to stay on the schools theme for a second. A couple of weeks back when we entered stage 3, we put off reopening community playgrounds because there just wasn't a good way to disinfect that, especially given the young age of the kids using them. How do we get around that same problem in opening elementary schools? How do you keep young kids observing social distancing and keeping their hands out of their mouths and so forth?
You talked about this.
Yeah, I didn't achieve it very well with my own children, so I'm not sure I can tell schools how to do that with very young children. You know, we realize that children are going to go back and they're going to play. The kids in my neighborhood are already playing together on equipment behind my house that we had for our kids when they were young. And, you know, I think the most important thing is that we continue to educate them at home, and we educate them at school, and we educate them when they're with their friends that they need to wash their hands, that they don't take their snacks back there with them while they're on the playground equipment and eat. And we continue to either let them have a little thing of alcohol in their pocket that they put on their hands, the alcohol sanitary equipment, or we wash their hands frequently. But, you know, kids, fortunately, are pretty resilient. And oftentimes, even when they get this virus, they have minimal to no effect from that. So that's a good thing. But we would like to prevent the spread of that infection as much as possible, and are very realistic about the fact that they are going to play and they're going to put their hands in their mouth, and we're going to do the best we can to point out to them over and over and over again not to do that.
Eric, did you have a second question?
I did, yes. As we're heading into the weekend, what's the posture of the National Guard? Are they deployed again in Fort Wayne or at the monuments? Have they stood down, or are they just on standby?
We are on standby statewide.
Steve with KPC Media.
Good afternoon, Steve.
Good afternoon. How are you doing today?
Doing good. How are you?
Pretty good, pretty good. Dr. Box, you mentioned a little bit earlier about some concern about numbers in Allen County specifically, but up here in Northeast Indiana, we are seeing some surges in several of our counties. LaGrange County has more than doubled since Memorial Day. Noble County's up about 50%. Elkhart County is up over 50%. DeKalb County, with a very small amount, is over 50% as well. So I'm wondering, are you seeing any concerning signs in the Northeast Indiana region? And I guess what message would you have to our residents up here, since we're seeing this spike in cases?
So we are looking specifically, we have looked and have been working with the mayors of Goshen and Elkhart, and also the county council and the local health officer there, and an outbreak, or I guess I would say an increased number of cases in our Latino population up there. So have been working very closely with them. Allen County, it came to our attention that there were increased numbers of individuals hospitalized with COVID-19. And so our data team kind of did a deeper dive of that for us. And really what we saw is that the increased number of positive cases really went right along with the increased numbers of tests that we were doing. Their overall percentages of individuals who were positive that were tested has remained traditionally right at about 13.9%. So that's been very steady, and that is it is above where we've seen in this overall in the state of Indiana. What we did see is that admissions to the hospitals there in the Allen County area have not really gone had a big increase, but the individuals that have been there a little bit longer, so it appears the length of stay has been there. And I think that's the additive nature of some of the people we know will be sicker, and it'll take 10 days, 2 weeks, sometimes even 3 weeks or longer for individuals to get better and get out of the hospital. So, you know, what I would say is that it mirrors some of what we've seen in certain populations up there, in that there has not been a strict sense of respecting social distancing and wearing masks in some situations, and I think it's continued to educate those populations most affected, and when there's congregate living, seeing if we can help them to have other places to isolate and live separate from other family members, because we know that risk within a home, if somebody's positive, there's a 10 times increased risk that you and that living in that same home will be infected.
Dan Klein, Wish TV.
Afternoon, Dan.
Afternoon, Governor. The National Guard will stand by. Should the state be doing more to keep safe and protect businesses in downtown Indianapolis this coming weekend? Did you or Matthew Hogshead make a mistake not having more resources on the ground, specifically Thursday night after all the destruction on Monday night?
I heard about every third word you said, Dan, but I'm going to try to fill in the blanks. We are not just on standby, we're on the scene statewide. So I gave you half the story earlier. I think Eric asked that question. But look, we are working with local communities, cities and towns all across the state of Indiana, with our Indiana State Police, with our Indiana National Guard, and we are there to complement the efforts of the folks who are directing their law enforcement agencies on that front line. And we'll continue to be not just on standby, but on the scene where we need to be.
Our final question is from Nikki Kelly with the Fort Wayne Journal-Gazette.
Afternoon, Nikki.
Hello, Governor. Dr. Box, I was wondering if you could tell us how many tests OptumServe is averaging a day, and also whether they are meeting the 48-hour metric in the contract, because I've heard from numerous people that they are waiting 4, 5, and 6 days for results from the state.
So with regards to meeting the 48-hour window, no, they are not. The labs that go through LabCorp more locally are running, the last time I looked, about 55 hours, but that is lengthened quite a bit if they're going out of state. And that's part of the reason that we are working with Optum to bring all of those labs to run through our local LabCorp here in the state of Indiana, and I think that will help that timing. I'm sorry that I don't have the average number of tests that they do, but I can tell you that it's usually somewhere between 1,700 to maximum maybe 2,600. I know that we've done around 36,000 tests, and not near as many as we're capable of doing. And that's why we are working to repurpose some of the Optum sites to move them to areas within communities that communities can identify as being a better location or a better site to test, especially certain populations that they have concerns about, but also to use them in a mobile fashion to help us almost as a strike team to be able to test along with our long-term care, test our employees, but also potentially help us with industries going forward. So we're really working to make sure that we can maximize the testing that we can get through Optum.
Thank you for joining today's briefing.